My name is Tatiana Putnam. Today's date is Tuesday, June 21st of 2022. Let's see here. And today I will be presenting on the anatomy and physiology of the retina. So first we want to talk about the different layers of the retina. So there is two main layers. We have the retinal pigmented epithelium and the neural retina. To start off with the retinal pigmented epithelium, we have cuboidal epithelial cells, and these are responsible for the nourishment and support of this layer of the retina, as well as a lot of other structures within the retina. And then we also have the blood-retinal barrier. Now this prevents molecules from passing from the choroid into the retina, which, as we will see later, is going to be super important because if this barrier is broken, molecules can get into the retina and it can cause blindness, temporary blindness. It can cause dark spots, either periphery or the center of the vision. And then our second layer, which is the neural retina, this has a lot of the other things that are necessary for light, for seeing, such as photoreceptors, which just turn light photons, so light that comes into the eye, into the electrical impulse, which then can be used for phototransduction, so how we see things. And we have the bipolar cells, which just is a pathway between photoreceptors and ganglion cells. So it takes this electrical impulse from the photoreceptor and transfers it to the ganglion cell. And then, of course, our retinal ganglion cell. And this forms the nerve fiber layer, so a lot of the optic nerve. And obviously it takes that electrical impulse. So then, looking at the types of photoreceptors that we have in the eye, there are two main ones, rods and cones. We also have another one called intrinsically photosensitive retinal ganglion cells. These aren't talked about much. We don't have many of them because we simply normally don't have a purpose for them anymore. These are responsible for phototransduction in the absence of rods and cones. And if rods and cones are working well, the need to talk about them and the need to use them is not very prevalent. So starting off with rods, then these are responsible for scopic vision and peripheral vision. And what this means is that scopic vision is times of low light, such as at night. So rods really help with this type of vision, as well as peripheral vision, which is seeing everything in our periphery. So not just things straight in front of you, but things off to the side that are harder to see. On the other hand, we have cones, which is our other very prevalent photoreceptor. These are very concentrated in the fovea of the eye, and these are responsible for high vision acuity and color vision, daytime vision. So seeing during the day when there's lots of light, cones are used. They help us see colors, differentiate between colors, and they're also used high vision acuity, which means picking out the details and images we see and seeing things clear for the most part. Now we want to look at the structure of the photoreceptors, so specifically rods and cones, since those are the main ones that are talked about. The first part of this is the neuroepithelial cells, and what these do is just absorb light that comes into the eye, and then it gets transferred to the outer segment, which captures this light from the neuroepithelial cells and converts it into an electrical stimulus for phototransduction used later in the process. We also have cilium, and what this basically just does is it connects the outer and inner segments, allows this electrical impulse to transfer from the outer to the inner segment, and just holds these two segments together. And then in our inner segment, what this does, it provides energy for phototransduction. So this is where we see things such as mitochondria, which provide this energy, as well as other organelles that can help out with this. Next we have the cell body, and this is important because it contains the nucleus. And then finally the synaptic region, or synaptic endings with synaptic vesicles, you can see in the image to the left here. This allows communication between photoreceptors and bipolar cells. So taking, this light from this photoreceptor and transferring it to bipolar cells for phototransduction. And now we want to understand the different, how structure aids function between rods and cones. We're going to take a look at the differences in structure and some same things in rods and cones. So to start off with, rods are very cylindrical in shape. they have membranous discs which just attach to the plasma membrane, and they are very thin. So if we go back and look at our previous image, we can see here the outer segments of the top part of the rod. It is cylindrical, although it's kind of hard to see. It's a different shape than the outer segment of the cone, which from here we can see the cone is conical or tapered or cone shape, giving it its name. It's also very short, and it also contains membranous discs. So if we go back and look, we can see the outer segment of the cone is significantly shorter than the outer segment of the rod, and also has this cone looking shape, which is clearly different than the outer segment of the rod. Now, something they have in common is their inner segments are both long and they have thin mitochondria. So going back to our previous image, if we look at the inner segment here, they are significantly longer than the outer segment of either the rod or the cone. We can see the mitochondria here, which we know are now responsible for providing energy for phototransduction that's later used in this pathway. Finally, looking at the synaptic regions of rods and cones, rods have what are known as sphericals, and these synaptic regions are smaller than cones. So again, we go back and look at our previous image. The rod on the left, at the bottom, the synaptic ending, you can see has less synaptic vesicles, less little projections coming out, and it is spherical in shape. So if you look at the bottom, it kind of forms a half sphere, compared to cones, which have synaptic endings or regions known as pedicles. And what this means is basically, if you just look at the bottom synaptic ending of the cone, it is straight across, known as a pedicle. And we can look at how the function aids this. So like we went over before, rods are responsible for scopic vision, peripheral vision, so nighttime vision when there's low levels of light, as well as seeing in the periphery. While cones are responsible for daytime vision, color vision, visual acuity, seeing when there's lots of light, seeing colors, and seeing things with a high level of clarity and a high level of detail. Now, from all this we've learned about rods and cones, the layers of the retina, the structures and the functions of different photoreceptors, we can now take a look at a case study which really helps bring this all together. So in this case study, we have a 61-year-old patient come to the doctor's office. He presents with a sensation that a curtain came up over his left eye, causing him to lose center vision. This was about a week prior that he experienced the symptoms before he came in to the doctor's office, and he also noticed what he described as flashing in this left eye, as well as floaters floating around in his left eye. He doesn't have any pain, but 3 weeks prior to him coming into the office, he had cataract surgery on this left eye. And after some tests, the patient was diagnosed with rhegomatogenous retinal detachment from a peripheral retinal tear. This is a lot of words, but this is caused by liquid vitreous, so the substance in the vitreous humor passing between the retinal pigmented epithelium and the neurosensory retinal. As we learned earlier, part of our retinal pigmented epithelium was the blood-retinal barrier, which prevented molecules from passing into the choroid into the retina, which I said was going to be important because when you have molecules passing through this barrier, this causes some of the symptoms this patient presented with, which was the floaters in his left eye, the flashing, and the lack of vision. The doctors later determined that could have been caused by his cataract surgery. So during this surgery, this barrier could have been disrupted. The retinal tear that he was diagnosed with could have occurred that allowed these molecules to pass into his retina. But the retinal detachment was treated with surgery. The patient recovered. He was able to regain his vision. And everything ended up okay, but it just, like I said before, shows how important knowing the structure and the layers of the eye is to diagnosing these things, and then the tests that you can perform to show, like, if this barrier is intact, if there is some molecules that are leaking through this barrier that are causing blindness. Thank you for listening to my presentation. Finally, we have some sources. Yeah.